morning, but just let you know, they're not going to be nice to look at. It won't be as bad as what my dad did this morning or his other presentations. So you can relax. It's not going to be that bad, but it's not going to look nice. So neuropathy, which is nerve damage that leads to a loss of feeling. Without feeling in your feet, you may not notice when you hurt your foot, which may result in your injury going untreated. Walking and untreated injury is the most common cause of diabetic foot ulcers. Every 3 minutes and 30 seconds in the United States, a limb is amputated due to diabetes. Amputations are on the rise in the United States. 160,000 people with the diabetes undergo amputations every year. And 80% of non-traumatic lower limb amputations happen due to diabetes complications. So every 3 minutes and 30 seconds, someone is having a limb being cut off. So, that's really hard to think about. That's a terrible reality, but it is happening. So that also brings me again to another Bible verse. For the life of the flesh is in the blood, and I've given it to you upon the altar to make an atonement for the soul, for the blood to make an atonement for the soul. So we have this principle that life is in the blood. If there's not a proper life, there's going to be death, and that's, again, what we're seeing with those with diabetes. So again, not pretty to look at. It's not pleasant, but these are real things. You're coming to a health presentation. You're going to have to prepare yourself for some not pretty things. So what about gas gangrene? Gas gangrene typically affects deep muscle tissue. If you have gas gangrene, the surface of your skin may initially appear normal, but as the condition progresses, your skin may become pale and then evolve to a gray or purplish red color. A bubblish appearance to your skin may become apparent, and the affected skin may make a cracking sound when you press on it because of the gas within the tissue. The bacterial infection produces toxins that release gas, hence the name gas gangrene, and cause tissue death. Like wet gangrene, gas gangrene can be life-threatening. You also have dry gangrene, which is characterized by dry, shriveled skin ranging in color from brown to purple blue to black. It usually occurs in people with blood vessel disease, such as osteoporosis. Wet gangrene is referred to as wet if there's a bacterial infection in the affected tissue. Swelling, blistering, and wet appearance are common features of wet gangrene. It can develop after a severe burn, frostbite, or injury. Again, it's not pretty, but these are what real people are going through. Heavy processed carbohydrates, such as those made with white flour, white sugar, white rice, are essentially whole foods stripped of important bran and fiber, as well as healthy vitamins and minerals. Calories devoid of nutrients with a high sugar content are the primary offenders. And so this is the doctor. This is a quote from a doctor, and it says, as much as possible, these foods should be eliminated because they are so easy to digest. These foods can cause spikes in the blood sugar and insulin levels, and over time, this could lead to type 2 diabetes. So that means there's going to have to be a change in the lifestyle. For people with diabetes, it's important to limit sugars and fats, especially found in junk food. This helps keep your weight and blood sugar levels under control. The ADA recommends limiting these foods because they usually take the place of more nutritious foods in the body. But it's going to be hard because junk food is going to be really hard to get away from. Even if you avoid foods occasionally laden with sugars and fats, such as cakes and fried dishes, fats and sugars can lurk in foods where you least expect them. Tortilla chips, noodles, muffins, croissants, and the cream you splash in your coffee may be high in simple sugars and contain harmful fats. Sugar also shows up in flavored yogurts, condiments like salad dressings, mayonnaise, ketchup, and is found high quantities in some fat-free foods as it's used as a substitute for fat. So if you're going to try to get a lifestyle change, you're going to have to look at the label and what you're eating. You're going to have to throw some things out. It's going to have to be an entire different change of what you're eating. You're going to have to cook more at home. It's not going to be a simple process. because this is not something you could just, oh, okay, I won't eat this. You're going to have to go through everything and see what can I change and what can I have to get rid of completely. So how much added sugar should we consume a day? Has anyone thought about that? How much added sugar? So this is processed sugar. How much of that should we consume a day? According to the American Heart Association, the maximum amount of added sugars you should eat a day are for men 9 teaspoons and for women 6 teaspoons. But if you want maximal health and you don't want to risk it, everyone should keep it down to 6 teaspoons max. But that's going to be really difficult. It's going to be really difficult because if you get a Dove chocolate bar, you get 5 teaspoons of sugar right there. Butterfinger bar, 6.9. Marshmallows, 14.5. So that's twice over the limit. Milky Way bar, 8.5. Snickers bar, 7 teaspoons. Twix bar is a little bit better, 2.75, but you're going to eat more than one of those, so, you know. Starbucks packet, 5.5. If you get a Coca-Cola, that's going to be 14 teaspoons of sugar. You get the cherry flavor, that's 16 teaspoons. So you're going to be way over the limit if you get anything from the store. It's just going to be really difficult. Sugary beverages like sodas, sweet teas, and lemonade are linked to increased risk of type 2 diabetes. According to a 2010 study in Diabetes Care, drinking 1 to 2 sugary drinks per day increased the risk of type 2 diabetes by 26%, compared with having less than 1 serving a month. So one of the best ways to minimize the effect of sugar on your health is to limit your intake of sugar-sweetened beverages, including fruit drinks. So to stay hydrated, drink more water. Also avoid loading up your coffee, tea with sugar and cream. So even things like, fruit drinks, we think, okay, it's fruit, it must be good, it must be healthy. I'm not saying you can't ever have fruit drinks, okay? But I'm saying once you take all the fiber out of it, you just got water that's sweet. That's it. You got sugar water. It's no longer really healthy anymore. I'm not saying you can't ever have it, but it's just like getting a Coca-Cola at that point. So that's something you have to really look out for. Sugary drinks. So I'm going to play this video real quick. What happens if you sit a tooth in Coke for 24 hours? So just, get an idea here. They put a tooth in a cup and put some Coca-Cola in it. And they're just going to let it sit for 24 hours. It's 2 hours, 4 hours, 8 hours. And after they take it out 24 hours, this is what comes out. So, that doesn't look very good. It's all decayed, all the enamel's all eaten off, and it's basically stained by that Coke. Now, again, it's an experiment. Of course, most people aren't going to sit their teeth in a Coca-Cola bottle for 24 hours. That's not going to happen. But you do it over and over again for a long enough time, eventually it's going to catch up with you. And you can see, again, the effects here, erosion, cavities. It's just not pretty. That's something you want to avoid as much as possible. So what about natural remedies? So, you see what diabetes is, you see what you shouldn't be doing, but how can we fix the problem, right? That's their main goal, right? To fix the problem. So as much as possible, we can use some of these simple remedies. So the positive effects of table sugar. For a long time, people have used sugar and sugar-rich substances like honey and molasses as traditional remedies to prevent infections and help heal wounds faster. This practice was based mostly on folk medicine. In fact, regular table sugar, sucrose, has been successfully used to treat hard-to-heal wounds with a success rate of over 99%. So I'm going to play this video, and I hope you can hear it.
In a hospital bed in Birmingham, Bill Drysdale
Can you hear
is
this?
having a radical new treatment for painful It's having a remarkable effect. It's cleared the swelling, it's cleared infection, it's reducing the pain, and what's happened, the blood is starting to flow back up the legs. So I'm really impressed.
And this was the treatment that succeeded when normal medicine failed. Simple sugar. The impact of ordinary sugar on these wounds can be extraordinary. This is a typical patient before treatment. As you can see, these ulcers on his leg are extremely painful. There's a nasty smell associated with the flesh, and they've been like this for more than 13 years. And this is the same patient after treatment. And as you can see, the ulcers have almost completely gone. This patient is now back walking, driving, and even swimming. For the man behind the treatment, after years of research, he believes he now has the proof that doctors want to introduce this as a standard treatment.
I have managed to do a randomized control trial, and the statistical results show that there is a significance in the use of sugar on wounds.
And Bill Drysdale would like to see the treatment adopted much more widely.
In Scotland at the moment, one of the reasons I've come here is that the district nurses and the GPs don't fully accept the sugar treatment. So here in Birmingham, which is an absolute centre of medicine, it's accepted, it's being used, and it's working.
Wider acceptance of such a simple, cheap, and effective treatment could bring real relief to thousands of people. Davy Gregory Kamar, reporting Scotland, Birmingham. In a hospital bed.
So sugar can be used to treat wounds because it has properties that draw fluid out of the wound and help kill the bacteria. So the bacteria in the wound, it's doing its thing, but the sugar actually sucks the water out of the bacteria. That's going to kill it. It increases the oxygen in the area, and it's going to disinfect the wound. Now, you think, okay, the very thing that you shouldn't be eating that causes the problem, you put it outside the body, and it actually is going to help recover the problem. And so again, it's kind of ironic in that way, but it does really work. So positives of sugar externally, not internally. Reduces edema. Sugar can be used to reduce swelling in wounds. It lowers the pH, can lower the pH of a wound, which helps kill the bacteria. Debreathes the wound. It can help remove dead tissue while leaving healthy tissue intact. It can help form new tissues in wounds. It can help reduce the smell of the wound, and it can help new blood vessels to grow in the wound. So how would you use it? So let's say again, we're just giving the simple things here. I'm not saying just go try this, but this gives you an idea of what's possible. 1 pound of sugar, 4 ounces of providine iodine. You can mix that together. Pour on the area, and the sugar should dissolve. Apply it 2 or more times after that. So when you put it on the wound the first time, it's going to start dissolving. Then you want to put it on again and again, and do it until it stops dissolving. That means it's disinfected. You can also spray colloidal silver over the spores 1 time daily. So you're going to do that as long as it takes, this process. You're not going to just do it 1 time, but for over... If it takes 3 months, you're going to do that. You can see here, this is someone with a gangrene sore. Again, doesn't look pretty. And they were using the sugar and also honey and other things. This is when they, I guess, first came to the man in this video. But over time, it began to heal. So Proverbs 16:24, it says, pleasant words are like as a honeycomb, sweet to the soul and health to the bones. So many of you have maybe read this verse before. And you're like, oh, okay, well, that's nice. Pleasant words are as a honeycomb, sweet to the soul, health to the bones. And you don't even think about it. It says that it's like a honeycomb, it's sweet to the soul and health to the bones. So in what way is a honeycomb health to the bones? You never thought about that? We just read over the verse, and we don't even think about that part. But honey is a mixture of sugars prepared by honeybees from the natural sugar solutions called nectar obtained from flowers or other plant secretions. By the addition of enzymes and the evaporation of water contained in it, honeybees transform it into a sweet liquid. Honey has a long history of safe use as a medicine. It appears also in many traditional remedies. A cup of hot water with lemon and honey has long been used to soothe sore throats. Researchers think it acts as a mild disinfectant for the mouth and the throat. Honey is sometimes taken together as a mild laxative effect, which researchers now believe is due to its high content of fructose, which absorbs the water and the stool. Honey has antibacterial properties, which have been well known for over 80 years. And there are many reports of its effectiveness against dressing for minor wounds, skin ulcers, and burns. Honey was used in ancient Egypt. It preserved bodies immersed in it for relatively long periods. Honey can be stored in containers and remain stable for decades and even centuries. So honey, it doesn't go bad. It crystallizes, but it will basically be there forever. And so it's great for preservation and to kill bacteria. Researchers reveal the ability of the honey to act as an anti-inflammatory agent. This means honey lessens the body's reactions to injuries by countering the effects of chemicals that produce the characteristic features of inflammation, such as swelling and pain. Honey has the ability to kill bacteria and fungi, which are disease-causing microorganisms that you should be cautious about when your protective skin layer is damaged during a burn. To treat minor burns, apply honey topically to the burn site. Manuka honey has gained recognition as a potential treatment for diabetic sores, particularly diabetic foot ulcers. Honey is considered bacteria's worst enemy because it has several properties that inhibit the growth of bacteria and other microbes. It has a high sugar content, so it's going to do the same thing as sugar, but it also has other properties, and we're going to come back to that. Honey's high sugar content creates a high optic pressure that forces water out of microbe cells, stopping their growth and reproduction. Manuka honey is probably the best, but garum and togla honeys will also work. So Manuka honey is a really expensive honey. It's out in New Zealand or Australia. It's a really good honey. It's really good for disinfectants, for wounds, infections, but it's expensive. So if you can't get that, use what you have, okay? You don't have to get Manuka honey. Just get the best thing you can get, and it's still going to do its purpose, but Manuka honey would be the best option. So pressure sores on, this is someone's backside here. So this is before, this person, they were laying on an area for too long, and eventually that area turned into a sore, and it started to be treated with the honey. And then afterwards, you can see this is afterwards. They used it for an amount of time, and the wound healed up. Clean the area with hydrogen peroxide. Put in a spray bottle and mix the area to clean and disinfect it daily. So you want to keep the area clean. Any type of wound, you don't want it to smell. You don't want it to get infected, so you're going to have to continue to disinfect it with hydrogen peroxide. So again, you could have a mixture of Manuka honey, turmeric, honey, use equal parts. And so you can mix it together into like a paste here and apply that over the wound. Due to the fact that honey may attract bugs or go bad, it's probably a good idea to change your dressings more frequently. Replace the bandage every 6 to 12 hours. Remove the bandage carefully, rinse the honey off, and either reapply the dressing or let your skin air out. So you can see like a little dollop of honey right there. I'm going to play this video. Hopefully you can hear it.
Honey. You've met honey. It's that sticky sweet stuff. Basically just slightly liquid sugar in a plastic bear bottle, right? Wrong. Honey is a supercharged bacteria-killing powerhouse, and it's all down to what those hardworking bees put into it, from immune proteins to the sugar itself. Since ancient times, honey has been used to prevent wounds from getting infected, and these days, we use purified and standardized versions of honey to fight infections in hospitals. Honey has three main tricks for fighting bacteria. The first is all that sugar. Honey is only about 17% water. Most, but not all, of what remains is sugar. The two main types of sugar in honey are glucose and fructose. Like all sugars, glucose and fructose are sticky. They attract water. Honey is technically a supersaturated solution, meaning it contains more sugar than would normally dissolve at that temperature. That's why it eventually gets all crystally in the pantry. Over time, the sugar comes out of the solution. Chemically speaking, it's desperate for water. Water can travel across cell membranes from where there's a higher concentration of water to where there's a lower concentration. And there's a higher concentration of water in a bacterium than in honey, which means that honey will suck the juices right out of any bacterium or mold or fungus that tries to set up shop. Plus, there isn't enough water in honey for any microorganisms to live on, so they die and the honey doesn't spoil. The second thing is that when bees make honey, they throw in an enzyme called glucose oxidase. And bacteria hate glucose oxidase because it produces two different compounds. It converts glucose to gluconic acid and hydrogen peroxide. Gluconic acid is, you guessed it, an acid. It gives honey a pH value of less than 4. That's about 1,000 times more acidic than the neutral pH of 7 that most bacteria need to grow. And hydrogen peroxide is very good at killing cells. It destroys the cell walls of bacteria, which breaks them apart. Glucose oxidase isn't active in ripe honey. There's not enough water for it to work properly. It seems to be there to keep the honey from spoiling while the bees are drying it out. But if you dilute honey, the glucose oxidase will switch back on and make gluconic acid again. The final thing bees do to make honey antibacterial? They put antibiotics in it. Some types of honey contain a protein called B-defensin 1, which is exactly what it sounds like. B-defensin 1 defends bees. It's part of their immune system and protects them from certain bacteria, including ones that cause nasty diseases inside the hive. It's produced in a gland that bees use to make honey, so it makes sense that some of it would make it into the finished product. And while scientists aren't sure how much of the protein really is in honey, it sort of makes sense that bees would use it to protect their food. Another antibacterial compound sometimes found in honey is methylglyoxal. Methylglyoxal is a small organic molecule that forms in honey from a compound in the nectar of certain flowers. There's an especially large amount of methylglyoxal in Manuka honey, a honey made from a New Zealand flower. This honey is so good at killing bacteria that it's actually used in hospitals. There's one bacterium that has honey's number, but only sort of. It's the type of bacteria that causes botulism. The bacteria start out as spores, which are very hard to kill. They're already dried out, so honey's water-sucking properties don't kill them, and because the spores aren't growing, they aren't affected by the acidity or the antibiotic compounds. The really dangerous part of the bacteria is the botulinum toxin they produce when they grow into mature bacteria. Less than 100 nanograms, that's billionths of a gram, is enough to kill an adult. About 10% of honeys have some botulinum spores in them, but since the spores in honey aren't growing and making toxin, they're harmless to healthy adults. Our immune systems intercept the spores before they can start growing.
Okay. So another thing you can use is also an Epsom salt poultice. So add 1 cup of Epsom salt to a few ounces of warm water. Soak a cotton cloth first, leaving it slightly moist. And place over the area to be treated and cover with a plastic sheet followed by a heating pad. So this is also, again, for any type of diabetic wound. Salt also has disinfectant properties and it kills bacteria. So here is actually something you can drink. Here is a natural immune-boosting antibiotic. So 1 grapefruit peeled very thinly so some of the white pit remains. 1 orange peeled very thinly so some of the white pit remains. 2 lemons washed thoroughly. You can leave the peel on. 2 garlic cloves. A large onion. 3 drops of peppermint oil, which is optional. And a teaspoon of cayenne pepper if heavily congested. Mix all together and drink 1 ounce 3 times daily. So you can use this as a natural antibiotic. So how do you know if a wound is infected? As your wound heals, look out for these signs and check a doctor if you haven't, or if you have. Redness and swelling, a lot of pain near the wound, thick grayish fluid draining from it, a fever higher than 100.4, or red streaks near the area. So you need to be really aware of this. If a wound, if it looks infected, you need to get on that immediately because that can spread through the system and it's going to cause a lot more problems. Also, you have an antibiotic ointment, a natural antibiotic ointment. Coconut oil, 8 ounces. Oregano oil, rosemary, peppermint, zinc, garlic oil, manuka honey. Vitamin C, you can mix all that together and apply as needed. And also, we have another healing salve, golden seal, 2 ounces. Myrrh powder, 2 ounces. Comfrey powder, 3 ounces. And rosemary powder, 2 ounces. Mix it together and apply it to the wound and let it dry. So some other things you can take internally for diabetes is L-arginine. L-arginine is an amino acid and is available in most health food stores as a nutritional supplement. In a 2007 study, it was found that the regular use of arginine in laboratory animals was able to stimulate the pancreas to produce beta cells, the special kinds of pancreatic cells which produce insulin. A golden seal. Golden seal is an herb with a long history of medicinal use, both in East and West. Modern science believes that part of its value as a treatment lies in the fact that it contains berberine, a bioactive compound, and berberine has been shown in studies to, like arginine, stimulate the production of pancreatic beta cells, which the body needs to make insulin. So for a long time, they believed if you had diabetes, those cells could not be restored. It was impossible to restore those cells. But now, with things like berberine, they have compounds that actually can bypass that system and cause the body to produce more insulin again. And so these are just some of the simple things that you can look into, you can use, and research it for yourself, and they're going to bring a lot of help. Stevia, this naturally sweet plant, now widely popular as a sugar substitute, is a good choice for diabetics for other reasons than avoiding simple carbohydrates. It contains compounds which have been shown to rejuvenate pancreatic beta cells that have been damaged. And its effects are similar to an anti-diabetic drug called glibenclamide, but without the unwanted side effects. So you've seen stevia probably in stores and stuff. It doesn't actually bring the blood pressure up. So it's sweet, but it does not, bring up the blood sugar. So it doesn't affect the blood sugar. Some people don't like it. They say it tastes kind of funny, but it can be really useful. Ginger. Those who do ginger capsules saw a significant decrease in blood sugar after 8 weeks. So this is another helpful remedy is to take ginger. Fig leaves. Diabetics who take supplements made from fig leaves do not need as much insulin as those who don't. The substances discussed above offer hope for treatment for type 1 diabetics that is natural and does not rely on synthetic insulin, whether from injections or a pump. And these natural treatments could make a huge difference to young type 2 diabetics and allow them to have a kind of normal life, which is difficult or impossible to have with the current mainstream treatments. So things like pumps and stuff are really intrusive. Again, these are things you can look into and see that this might be an alternative that you can move towards. Results from a study published in Diabetes Care Journal 2003 suggest that casa cinnamon or cinnamon bark improves blood glucose and cholesterol levels in people with type 2 diabetes and may reduce risks associated with diabetes and cardiovascular disease. So you can cinnamon bark, take 4 capsules 2 times daily, or eat 1 tablespoon 2 times daily. I would probably go with the capsules, but again, it can be really useful. Again, you can have some of the measurements here. I'm not going to go through it, but you can take a photo and see that for yourself. Coconut and a turmeric salve. Externally, rub on the skin sore. Mix 16 of the coconut oil, or 16 ounces of coconut oil, and 4 ounces of turmeric powder. Apply over the skin to prevent cracking and bleeding and cover with a clean cloth. So again, you got coconuts and the turmeric salve, also really good for disinfecting the area and promote healing. You can also use a hyperbaric chamber. Hyperbaric oxygen therapy and topical oxygen therapy are both treatments that help you that use oxygen to help you heal wounds. So this is also another really helpful treatment you can look into. So you're going to have to change your diet. You're going to have to eat some whole grains, especially buckwheat, millet, raw vegetable, and citrus fruits. Fresh vegetable juice, fresh pressed vegetables are going to be really beneficial. Eat a large salad 2 times daily. Eat 85% raw diet daily. So you're going to have to change your entire lifestyle. You can do some of the remedies, but if you're not changing what you're eating, you're not going to get any improvement from that. Charcoal. A charcoal boot for a gangrene poultice. Pour boiling water over 1/4 pound of charcoal. Add 1 ounce of cayenne pepper, 1 ounce of garlic. Let it steep for 20 minutes, then mix 2 tablespoons of whole wheat flour, enough to dry charcoal to make a poultice. So you're going to add the whole wheat to thicken it a little bit, just so it can be a poultice. Spread on a piece of gauze a little longer and a little larger than the affected area so they can be covered well. Apply it and lay over another piece of gauze over it, and then you can bandage that. So I'm going to close here. Hopefully you've given some information you can think about, you can use for yourself. I'm just going to end with this, the scripture here. It says, "Not that I speak in respect of want, for I have learned that in whatever state I am, therewith to be content. I know both how to be abased and know how to abound everywhere in all things. And I'm instructed both to be full and to be hungry, both to abound and to suffer need." So, Paul here is describing, he had a little bit of self-control, right? So that's important to have self-control, to discipline ourselves, especially when we're trying to get rid of any type of condition. It's going to be a hard process. We're going to have to make really big lifestyle changes. And so we're going to have that self-control. But he doesn't end there. He doesn't just say that. He ends with another verse that we quote all the time. And we didn't know it was in the context of these verses, which are about health. He says, "I can do all things through Christ, which strengtheneth me." So that was what kept him going. That what kept him going through was that I can do all things through Christ who strengtheneth me. So everything else about how I know how to abound, I know how to be abased, he knows how to have self-control. If you don't have this last part, you're not going to be successful in those endeavors. So I hope this presentation has been helpful. I believe we're going to have a question and answers. So be able to ask some questions or any things that you'll have. We're going to try to address some of that. So that's all I have for right now.
Okay, I really hope you enjoyed that and learned a little bit how you can help somebody. I tell you, it can be a challenge when you're working with diabetic sores, bed sores. I worked, my son and myself and team here worked with bed sores so big you could put your fist in a person's backside, and it's really tough to deal with. So you have any thoughts or questions on the presentation or anything you might want to ask? Yes, ma'am. Did you want to pass the mic, or they can do it just like that?
Who had a question? Hold the mic up.
Have you guys heard of the bitter melon capsules to help with glucose?
Oh, yes. That's one of our favorite. Bitter melon.
Bitter melon.
It's bitter, and it's a good insulin substitute. We give all our diabetic patients that.
Okay.
Sure do.
Bitter melon.
Yes.
Okay.
I have a granddaughter that has HNS, hidradenitis suppurativa. And so do you have any more information on that and how, like, cure? And I know it's dietary diet. She is trying to correct some situations in her diet, which is nice. It's becoming more prevalently,
So can you tell me what she's going through? What kind of
She
symptoms?
has these sores under her. They're like, they're worse than eczema that she has under her arms, pits, and in her personal areas. They're like boils.
Yeah. Yeah, it's very similar to a staph infection that we work with. I work with Staphylococcus A flesh-eating disease, and it's really aggressive. And it's a number of things we do with that. One is we take pine tar.
Pan tar.
That's from the pine tree. you know, you can
Oh,
pick up.
okay. We've
Yeah,
been doing
n-
some charcoal, activated charcoal's been helping a little bit.
Yeah, it will. That pine tar will do a
Pine
wonderful
tar?
job.
Okay.
You can purchase pine tar online, and you just smear that over the sores, and also spraying it down with colloidal silver. That's one of the most effective natural antibiotics you can use. The Manuka honey, as my son was bringing out, one I would use Manuka honey and turmeric. I would mix them together, make a salve, ointment out of it, and then apply it on top of it. You really need to boost her immune system because all of us have staph on us, and it will, if your immune system get too low, it will start, you know, breaking down our mucous membrane, our skin, and we get sores. When I was young, and I'm not, you know, I'm kind of eccentric, but I remember my granddaddy, he had a hound dog, and the hound dog ended up with mange. Some of y'all may know what mange is. They break out with sores all over their body. And my granddad loved his dog, and they would say, Mr. George, I'll take that dog out and shoot him. But he said, no, I love my dog. And I remember he took a foot tub and some used motor oil, and he sponged that dog down with used motor oil, and it cured that staph. And I thought it was the most ridiculous thing in the world. But I ran across to a brother named, and if it's on YouTube, I hope he's listening, Brother Franco Teller, a really well-known medical missionary physician out of Memphis, Tennessee. And he ended up with a flesh-eating disease, Staphylococcus A flesh-eating disease, sores all over his body from head to the toe. He was Job all over again. And I had no clue what was wrong with him. And you could go in his room, you see little scabs floating in the air, you know, and you're afraid you're going to get contaminated. But if he sat down somewhere, you leave an imprint. So he asked me one day, he said, have you ever seen anything like this? And I said, yes, my granddad had a hound dog, look almost like you looking right now. And he said, what your granddaddy did? I said, he put motor oil on him. He said, bro, put the motor oil on me. He said, I have nothing to lose. So I was hesitant, but I went and got a sponge, and I lightly sponged him down with the motor oil. 3 weeks cleared it up totally. And then from there, I said, well, people have tatter or ringworm. I just take a little motor oil, and I rub it on the tatter, and it kills it. So I was curious to know what is it in that motor oil that's doing that. And I found out it was coal tar. It was coal tar in the motor oil. That's where they get it from. And so when I tell people this, they said, no way would I ever put motor oil on my body. It's carcinogenic. I said, yes, it is. I said, but now you better stop using that white petroleum jelly because that's motor oil too. That's purified motor oil. You do know that, right? So you get that Vaseline, that is motor oil. So I'm not saying, the pine tar will work perfect for her.
Okay.
You may not
You
want to
said
use the
Frank
motor oil, but
Otella?
in a desperate situation, I probably would use it. Okay.
Would that help with eczema as well, the motor oil?
Eczema is related to a liver malfunction. A liver is not processing fatty acids, fat down to fatty acids, and the liver is overburdened, and a person will develop eczema, psoriasis, and those kind of conditions. They really need to go on a good liver detox. Clean that liver and that bowels out. And then what you want to do is to take some virgin coconut oil and with just a couple of drops of peppermint in it and just massage them down with that.
Okay.
Yes, it will. The motor oil would help with eczema and psoriasis, but like I said, most people don't want to use it. That's an old country southern
Yeah,
remedy.
but if it helps.
But it works fine.
Okay, I have one more question. What about raw sugar? Is that any good at all, raw
Well,
sugar?
You know, all sugar, brown sugar, raw sugar, organic sugar, they're all deadly sugar. There's no sugar that's good. Sugar is so toxic to the system that bacteria and germ cannot live in it. And that's why it's so effective in a putrid wound. The bacteria and infection cannot live in sugar because sugar produces a carbon action. As my son was bringing out, it creates what we call osmosis. Osmosis is because sugar is a carbon, and carbon attracts water. It soaks up water. So when you put it on a wound, it pulls the water out of the tissue and the putrid cells, depriving the cells of that moisture, and it kills them. It's by chemical action. It is dynamic. We're working with breast cancer at our facility right now. A girl had a large breast tumor when she came, and the sugar and iodine treatment has debrided 50% of the tumor off of her chest. So, and it don't take long. You put it on there, and you clean it, and chunks of dead meat will drop off because it deprives those cells from what it needs to strive. Anyone else?
What do you use in the home in place of Vaseline? You said Vaseline is...
Well, I didn't say Vaseline was no good.
Okay.
I didn't say sugar was no good. But it depends how you use it. If you don't have anything else but Vaseline, I would use it. I mean, you can take Vaseline, cayenne pepper, and eucalyptus, and peppermint, and mix it together and make a salve out of it, which is a cayenne salve. And it works fine, you know. It's ointment. But if you don't want to use Vaseline, you can use coconut oil and put a little bees wax in it. Melt the beeswax, put it in a little coconut oil, and make your own vegetable type of Vaseline. And then you mix your peppermint, your eucalyptus, your cayenne pepper in it, and you can make your heating salve out of that. I was talking to this sister in the back there. She got a problem with her knees. And what I would do is I would take about 8 ounces of either Vaseline or coconut oil. I would take about 2 ounces of beeswax, melt the beeswax, mix it in the coconut oil. If you don't want to use Vaseline, mix it to a liquid. I would take 6 teaspoons of cayenne pepper, and I'd try to use the 100,000 or 90,000 heat unit cayenne pepper. 6 teaspoons, I mix that in that. I take a teaspoon of peppermint, teaspoon of eucalyptus, a teaspoon of camphor, and I mix all that up together. And then I put the magic bullet in it. I put about 2 ounces of DMSO in it. DMSO, that's a solvent. It's the strongest solvent we have in the universe. I'll tell you a little about it a little later. You mix that in it, all up together. You apply that on a piece of cloth, lay that on your knees, and you're going to be amazed. Though that knee will stay warm all night long. It'll feel like you got a heating pad. Okay. I know I'm talking too fast. Okay. Okay, just go back to YouTube and get it. Okay, anyone else?
All right, so I have 2 questions. One is in relation to honey. So, you know, we generally make tea and sweeten that tea. So is it good, or just say you make some fruit juice and you want to add some sweetener to it, is honey safe to use that way?
You know, a little old inspired lady, she made a statement. She said that one of the best things for respiratory infection is a little eucalyptus or put in a little honey. And she said it's the most best thing in the world for any type of lung congestion and colds and coughs. And that was a sister named Ellen G. White. She was way ahead of her time, and it works like a charm. Honey is really a soothing to the mucous membrane. The whole gastric tract benefited from honey. It's very healing. And so, yes, they have cough drops they make out of honey. honey is fantastic. So in all forms of it. The only thing about it is, like I said, if you're working with a severe diabetic, you may have to modify that because honey will have a tendency to raise the blood sugar level.
All right, so my next question is in relation, and I'm going down the street where Sister Frederick just went. So you just gave a remedy, and you gave us the ingredients, the mixed, and so on. I know you have some publications out. Are these ingredients and instructions in your publication? Because if that's the case, I see my sister was writing, and then you lost her. And so if that's the case, then we could just get that publication, and the instructions are there. Could you inform us on that?
Many years, I've been doing this work now for 56 years, and I do it 100% I haven't worked for man in over 56 years. I finished the university. I went to 8 years to university to be a technical illustrator for Sanyo, a Japanese company. And I illustrated components for the future, like flat TVs and cell phones, and we was doing that way back then when you had little round TVs and no color, just put a film on there, green for the grass and blue for the sky. We was already working on color TV sets way back then, and the cell phones y'all using now, we had the little dial-up phones back then, but we was working on cell phones. And so, it's just that technology has really evolved where we was way ahead of time. And so with me, my mind has always been looking, even when I left that company, I wanted to always be ahead of the curve. And I would study and study and study. So I began to, when I was introduced to the Advent faith, and that's a long story, but I was introduced to the Advent faith, and then a girl gave me a book called Minister Healing and Great Controversy. And I took the book because I was interested in the girl. I didn't care nothing about the book, But my aunt wanted me to be a doctor, and but I went to art school. It was much easier to be an artist than to be a doctor. So I went on to art school, but when this girl gave me that book, it really started up something. And I found out that God had a lot to do with health. I found that he was a doctor and a preacher. And then from there, I got the book, Back to Eden. And I was introduced to Jethro Claus. From that day on, I wanted to be the black Jethro Claus. I'm just going to tell you that my ambition was to be just like Jethro Claus. And so I wrote the book called Back to Adam. I wrote the book called the Back to Adam series. There's 3 books now, and that book has been in print a long time. And so everything we're talking about is pretty much in those books. Okay, anyone?
Yeah, Dr. Wilson, can applying essential oils help with diabetes, like frankincense, lavender, peppermint, and so forth? Do you ever use essential oils?
I do use essential oils for, like infections, staph infections. I use it as a calming, relaxing agent. It has a good place. But for if I got a diabetic sore, yes, I would make ointments out of it. That's about the limit of it. And as you mentioned about essential oils, you know how expensive it is, right? Yeah. It's very expensive. I teach a class based on 2 Kings, the 4th chapter. And that's talk about the lady with the crude of oil. Y'all heard about that story, right? You remember she was poor, and people was coming to take her 2 sons and make slaves out of them because she was indebted to them. And she told the story to Elisha. And he asked her, do you have anything in your house of value? And she didn't have anything but a little crude of oil and a little piece of bread, and she was planning to eat that and die. But he told her to go to her neighbors and everybody and gather all the pots and buckets it could. And he would bless the oil, and it would never run out of oil. And that lady started an oil business, okay, a major oil enterprise. She filled up all the containers and buckets, and she had plenty of oil, and she had a good, nice home business. I wanted to have that experience. I wanted to see, is that possible? And God is so merciful. He let me experience a little of that. And I tell you what I can do. You talk about essential oils, any type of essential oil. I don't care if it's lavender, peppermint, eucalyptus, whatever it is, rose. Give me 1 ounce of it, and I can convert 1 ounce to 1 quart. You take that 1 quart, and I can convert it to 1 gallon. I can take that 1 gallon and convert it to 5 gallons. All right? I can do it by God's grace. I teach it every year. And the way we do it is this. I just take lavender, for instance. I take 1 ounce of lavender. I take 4 ounces, between 4 to 6 ounces of water. Well, I said 4 to 6 ounces of vegetable glycerin, 4 to 6 ounces of DMSO, and 4 to 6 ounces of water, and 1 ounce of lavender, whatever it is. Mix it in there. In less than 10 minutes, it'll convert that whole volume to pure lavender. Where do you find some of those? You can buy everything. It's online. The DMSO, and then I forgot, 4 to 6 ounces of vegetable glycerin. So you mix all those together. In less than 10 minutes, you would have 1 quart of lavender, or peppermint, or oregano, or rose, whatever you want. Now you go to the internet and you buy these little 1 ounce bottles, and you fill all them up. You go and get your little gum labels printed and put on there, Mamon Wilson Organic Essential Oils. If I spend $12 for that little, or $15 for that little bottle, now I done made maybe $32. Are you with me? So I said, if you give me $100, I could turn you into the essential oil business. Just $100, all right? And look, the beauty of it, it never runs out. Because when I make that 1 quart, and all I got to do is save me some of it and start the process all over again. It's kind of like that sourdough bread trick. You know what I mean? You just keep that starter. There you go, sister. Now, I challenge you, start your essential oil business, okay? If you really want to know detail how to make it, I don't mind sharing it with you. You're going to put them expensive essential oil business out of business because they're overcharging you in the first place. Any other question?
So for someone that has like acid reflux, I saw you have a lot of citrus things, the peppermint that would irritate someone's stomach. What can you do in place of that, like the immune thing that he showed, and the cayenne, anything spicy like that would upset?
Right. Yeah, acid reflux, a GERD, is a big problem. I mean, you get it, you eat, I don't care what you eat, it's just causing problems. You can take super papaya chewable enzymes. You can buy that in the health food store online. Chew 8 to 10 super papaya chewable tablets right behind each other. In less than 5 minutes, the acid reflux is gone. Now, if you do not have the super papaya enzyme tablets, you can use a semi-green papaya, cut it, and chew a chunk of it and swallow the juice. The juice is fortified with latex. That's that yellow mercury solution in the papaya. It's high in latex. And it too will stop the acid reflux. You can also take some charcoal. Charcoal would neutralize it. And in a desperate situation, you can take a half a teaspoon of aluminum-free baking soda, put it in a little water, and that knocks it right out. Remember, don't eat between meals. Don't eat your fruits and vegetables together. Don't drink with your meals, and don't eat when you're in a lot of stress, and don't eat and lay down. That are the major reasons why you have GERD or acid reflux.
But so I was wondering though, but what can you substitute in that immune support, like the things that would irritate your acid reflux? So that helps the acid reflux. But with the citrus, the different things that were part of the immune support, what can you put something in place of that?
Well, you can eat those things. It's just that what it is, your body is already producing too much acid. And so once you get your pH back in balance, what you want to do is go to the drugstore and buy some litmus paper. And that's a little strip of paper you put on your tongue, and it check your pH. If your pH is too acid, then yeah, those citric acids will cause a problem. You need to eat more of the alkaline-based fruits and foods until you get that pH back in balance. Once you get it in balance, you can begin to eat those acid-forming foods without any problem. But once again, the problem with it is not so much the food, it's the stress level, eating in a big hurry, eating and drinking with your meals, eating wrong combination of foods. I tell you what they did. They did an experiment many years ago, and Dr. Kellogg, which I studied a lot from him, what they did is they found that pregnant women, when they, have big problems, with nausea and throwing up when they eat, and nothing would stay down. So what he did is he was trying to come up with a medicine that would help pregnant women and people that have this acid reflux and people that have upset stomach. And so what he did, and he took some corn and he soaked it in some water and he left it on the table, and somebody knocked the bulb off on the floor, and they stepped on it and flattened the corn out. And he looked at it, and because he's such a creative mind, he made cornflakes out of it. Then what he did, he took the cornflakes, dehydrated them, and gave it to pregnant mothers to chew on with no milk, no liquid in it, just chew a handful of it, and it stopped the nausea. So we do a lot of our cancer patients like this. They can't eat nothing, just smelling something, they throw up. We let them eat dry food. It's impossible to throw up dry food. And you eat a few chips, cornflakes, or crackers, just to condition your stomach for food, and now they can go back to eating.
Going back to the oils, have you heard about castor oil? Because I had some pain in my shoulder, and I would just put it like on a salve and let it soak in there overnight, and it helps the pain.
It does.
Okay.
Yeah, we use a lot of castor oil packs. Now, the key component with castor oil packs is you want to have at least about a half-inch thick piece of cloth. It's thick. A lot of people have a one-ply piece of cloth. It's not effective. About a half-inch thick. Saturate that with a lot of castor oil and heat that up and apply it over it. Like you have a bursitis, what you're talking about. Bursitis is you got, that bursitis can get hard, so when you get ready to do that, it's cracking, it just kills you. You can't do this here. That rotator cuff, you're right. You know what I'm talking about. So you take that and you take a paper cup and fill it up almost up with water, and then put about 2 or 3 ounces of DMSO in that water. Then you put some cayenne pepper in it. Put about 4 tablespoons of cayenne pepper in that cup of water and freeze it. You freeze that, so you got a cup of frozen water with DMSO and cayenne pepper in it. Then you cut away about 1 inch of the paper, exposing the ice. And then you rotate that in your shoulder. Just rotate it till it gets so cold you numb it. Then what you do is you spray DMSO on top of that. And you give a person 100 milligram of niacin, vitamin B3. And then that would loosen that joint up where they'll be able to. And then you do your castor oil packs. The purpose of the castor oil pack is to break down, dissolve the calcium deposits that get in the joints. You get calcium deposits. The castor oil will dissolve those deposits so you can raise your arm up.
I know you talked about COVID a little bit, but what about Alzheimer's? What can be done about that as far as
I've worked with a lot of Alzheimer's. I mean, my first case with Alzheimer's will go back, maybe 30, 40 years ago. And I was young and thought I was ready to bust the world on fire. And they brought an old man to me named Herman Carson from Iuka, Mississippi. And I'm going to tell you something. Iuka, that lets you know I got a problem. And Mississippi on top of that. So they brought him to me, and he was on diapers, and he's slobbering all over himself. And the only thing he know is one word, that N-word. And I hadn't got the victory over that N-word. And so I'm struggling because every time I hear it, my hair stand up. You know what I mean? And so they said, well, can you work with him? I said, no way. I don't have time to be working with somebody in diapers, slobbering on themselves, and all he knows is that ugly N-word. I said, no way. That night, when I got ready to go to bed, the Holy Spirit came to me and said, you need to work with him. I didn't want to. I got up and I said, I'll try. I was going to try for about 3 weeks and let him go. I kept that man for 4 years. And his mother, she's deceased now, she kept him for 2 more years. We had him a total of 6 years. That man used to travel with me like I'm doing right now. He was way up in age, and he would help me do these seminars. Brought his mind 100% back. But it took 6 years. We eliminated the TV set, because TV, it flickers. See, you don't see it, but your brain picks that flickering up, and it numbifies the brain and destroys the brain cells. We eliminated all aluminum out of his diet, aluminum deodorants and toiletries. We got rid of all of that, and we put him on a gluten-free diet, and we exercised him. I had to train his mind, and it came to me that you can train a dog to scratch at the door and let you know he needs to go out and ease himself. You know that. And he said, that dog got a lot of sense. That dog ain't got no sense. You know, only person got sense got to have a frontal lobe. And mankind is the only thing got a frontal lobe. If a dog had a frontal lobe, he would reason from cause to effect, and he'll seek salvation. Only a human can seek salvation. But he can mimic it so well that he makes you think he got a frontal lobe. I said, if you can train a beast to let you know he needs to go outside, and he don't have a frontal lobe, what can we do with somebody with a damaged frontal lobe? So I would systematically, every day, when I get ready to feed him, I put his plate on the table, I put his socks and his shoes on the same table with his plate. I said, Brother Carson, you're going to put your socks and shoes on before you eat. But he want to go right to the food. I would catch his hand and guide it to the socks. I said, we're not going to eat till we put the socks on. And I would help him put his socks on, put his shoes on, and I said, now eat. I did that for 3 months, every day. So he got the notion that only when he's going to eat, he had to put his socks and shoes on. After that, I went to another thing and another thing until I got his mind back in gear. And it's geared up, and it was no problem at all. And from there, I worked with a lot of other Alzheimer's patients. Now, I gave them herbs such as club moss, and club moss is fantastic for Alzheimer's, senility, just any type of mental problem. Club moss. We gave him a strong club moss tea, and then we gave him 1 tablespoon of extra virgin coconut oil. which is a good fatty acid. We gave that to them 2 times a day. And we gave them B vitamins, and we gave them a healthy diet, and we incorporated them into the family. Remember, our old people are matriarchs and patriarchs. They are not designed to warehouse away in a nursing home. Nursing homes is the world's way. That's not God's way. And so if we would let them use their mind, mind would never waste away. So just think about that. They change your diapers. They sacrifice their education for you. Now it's time for payback. Okay, any other questions?
What is,
Yeah, we did. We put them on nothing but whole grain and whole cereals. We didn't use any of the commercial grains at all. And it's terrible what they've done to our grains. Ancient grains are much better. And these whole wheats and other grains, commercially prepared grains, creates allergy in the system. It produces mucus, inflammation in the body. You don't need that. So a big problem we do is we bake potatoes and we wrap it up in aluminum foil. And that's a deadly combination because that starch extracts the aluminum from the foil into the potato, and you eat it. And aluminum is not biodegradable. Once it gets into the bloodstream, it's a nanoparticle that floats right to the brain, cross the brain barrier, and start destroying brain cells. So please get rid of your aluminum utensils, aluminum foils. That stuff is deadly, and it's messing our brains up. Anyone else?
what is the D, you've been saying it a lot, DMSO?
Yeah, DMSO is a natural solvent that comes from the pine tree. The pine tree have a fat soluble and it has a water soluble. It's the water soluble solution they get from pine bark or pine trees. It's a solvent, and it's very powerful. Now, what we do with that, for instance, you hear of nicotine patches, and you hear of pain patches, and you hear of all kind of medicine patches, right? Well, you can take DMSO, soak it, put a little coconut oil on a piece of cotton cloth, wet it with DMSO, and then you can put testosterone or you can put estrogen on it, and you can stick it to a person's body, and you send it right into their bloodstream. You can do it. You made a hormone patch, or you make a progesterone cream by putting DMSO with wild yam and put it on your body. It's going to send it right to your bloodstream because DMSO is a powerful solvent. It will cross your mucous membrane, your tissue, and go right into the bloodstream. And it's one of the most powerful natural elements we have. Water is a solvent, alcohol is a solvent, but nothing would beat DMSO. DMSO was really promoted by veterinarians, which I think are the best doctors in the world, and they use it on animals, and they got tremendous success from it. Then your sport doctors began to use it because people that was in the horse racing, they noticed that horses would damage their muscles when they run, so they would sponge them down with DMSO, and they'd be back running in no time. From there, then track runners and ball players, they began to use it. Today, it's pretty common. It's just a lot of us haven't heard of DMSO. But it's one that you might want to look into.
So you can get that on Amazon?
You can get it on Amazon, or some of your health food stores have it. I buy it by the gallons because I use a lot of it.
And if we don't use aluminum foil for me to bake my sweet potato, should I put it in a skillet?
Oh, yeah. You can put it in a skillet. Just, yeah, I mean, there's some cooks in there to tell you how to do it. But I'm just saying, you can bake it without doing that. It's still a bake. And you're going to do yourself a world of good because, see, you don't see what's going on. But I give you a good example. When you use aluminum utensils a lot, you can look at the bottom of the pan and you can already see little dark spots in it. That's what aluminum was at one time. I tell people about boiling water, you know. And there are times you might have to boil water, but keep in mind, if you depend on boiling water because it purifies the water, let the water boil all the way out one time. And let the pan cool down. Take your finger and rub it across the bottom of it. Guess what you're going to see? Calcium carbonates as a white powder that was in that water. Those calcium carbonates is what's going to cause kidney stones and gallstones and going to cause a lot of plaque build up in your arteries. And you're drinking that water, but you don't see it. But it's there all the time. Now, in an emergency situation, you may have to do it, but don't make a habit out of it.
Education on microwaves.
Right.
I have put my baked potato that I want to make real fast in the microwave, and I hear it draws everything out of the nutrients and everything.
Right.
I do hear this, but how dangerous is a microwave to our food, except for corn? I heard it doesn't do anything to corn.
This brother here, you just got him jumping around.
My Randy? Oh, yeah.
Oh, so it's obvious some of y'all know about microwaves. They did an experiment with microwave, and they took milk, and they put it in the microwave, and they gave it to guinea pigs, and all of them died.
Give it to what? Guinea pigs?
Yeah, let them drink the milk, and they all died. For malnourishment, because the microwave kills all the nutrients in the food. You'll come out better just eating a bag of potato chips. You'll get more nutrients in a bag of potato chips than using a microwave to. No, get rid of it. It's just a deadly machine. It's for people that's on the go, fast, and not only is they speeding up their life, but everything else. Okay, so we're going to save some more for tomorrow, if y'all don't mind. But I've enjoyed it, and tomorrow we have another session. And if ever you need our assistance, we have a school. We train medical missionary physicians. It's a 30-day on-campus school. You stay with us for 30 days on our campus, and we teach you the technique of medical missionary. We teach herbal surgery, herbology, hydrotherapy, dietetics, and country living. So if you ever want to come to school, and another thing about all of my students that go to our school, we are, to my knowledge, the only institute that guarantee employment when you finish. Now, the reason I did that, because I tried to go to all our institutions, and they turned me down. Every one of them turned me down because I had 3 liabilities. You know what it was? I was black, poor, and ignorant. And you ain't going nowhere but the ghetto with that. So they didn't take me. They said, no, you're not qualified. You can come, you can wash dishes, you can do yard work, but no physician. You don't have no medical background. And I felt God wanted me to be a medical missionary physician. And so a dear brother named Art Jacobson that started ASI, he found a rich man, wealthy, German. He gave me my first break. What he did is he turned the institute over to me up in Kitwanga, Canada. And he said, Brother Wilson, after I've worked on him, he was one of my patients, and God blessed me to help him, he turned that place over to me for $1 a year. And he did, $1 a year. And from then, that was where I did my school, my medical missionary physician school. And I trained up there until 9/11. And then we couldn't no longer come there, so we moved it back to the States. But God told me to raise my own school up, do my own certification, and that's what I do. So now those places they call us for help. They do. And most terminal cases, they contact us to take the most terminal cases. We are the ER of medical missionary work. We take in, most of our patients have less than 3 months to live. Most of them have about 3 months. And so when they come there, we know this is the end of the road. And so we have to train our missionaries to be able to deal with that. If somebody have a heart attack, what you gonna do? You're going 911, okay, fine. And what you gonna be doing in the meantime? You need to be doing something. Somebody are hemorrhaging, blood shooting everywhere. We had people blood shooting up in the ceiling. What you gonna do? How you gonna stop that? We have to train them how to stop that hemorrhaging and bleeding. Some women have a bleed out, a vaginal bleed out, blood just shooting out like a fountain. What you gonna do? And see, most medical missionaries are not equipped to deal with that kind of stuff. What you gonna do if somebody, lose their eyesight? How you gonna restore the vision back? You need to be trained how to deal with those things. So if you're interested in coming to our school, we would love to have a chance to work with you. Our schools start, I think it's September the 21st, and that's our fall class, and then we do another class in April. Okay. What's the website?
It's Centurion Bible School of Health.org. Centurion Bible School of Health. Or just spell out my dad's name, Mamon Wilson, and you'll find it.
Okay, thank you. And I have to sit down because I'm going to tell you this here. I have a limit how long I can stand. And I always let people know this. I'm good for about 2 hours, hour and a half, and I got to sit down because I was born with club feet. Y'all know what that is? And if I don't sit down, then I have my body said, go sit down.
All right. Thank you very much. Well, I don't think I need to say anything other than to let you know that we continue on tomorrow morning at 10. Why do we continue tomorrow morning at 10? If you hope you have one of the flyer and you can follow the schedule. So we for tomorrow we have guidance on how to make substantial changes within the family and community. Individual counseling sessions. So if you want to have an individual session with Brother Wilson, with Dr. Wilson and his team, then you can have that personal session with him, and that we start at 10 tomorrow, and then we have question and answers and product sales. So some of the things I imagine that they would have mentioned, they are on sale. In terms of these books, they are not available here, but you can have them online. You can have them online, as well as you can arrange with him, we can arrange with the team to have those publications sent to you, however. So tomorrow morning, we begin at 10. It's very important. Sister Stewart? Oh, absolutely. So you can book your time right now as we close, or when we close, you can book your time for tomorrow, and that would be very, very helpful for us as well. All right, and then we continue on Monday evening at 7. We will be making Dr. Wilson and his team will be traveling on Monday. Okay, so they will be traveling on Monday back to Tennessee. So we want to keep them in prayer in that. But let's come out tomorrow. Spread the word. Spread the word. We have several of our flyers available, and you can take them, as many with you, and spread the word. But on Monday evening, we'll be looking at depression. On Wednesday evening, we'll be looking at Abundant Life. And then on Friday evening, we look at exercise. And then we close out the week on Sabbath at 11. And we will look at the importance of water. So we invite you to join us for these sessions as well. And we begin in the evenings at 7 and on Saturday at 11. All right? So we look forward to a wonderful day tomorrow. And as we continue on Monday, we look forward to having you as well. All right? I want to say thank you very much. You have an announcement that you want to make, and then we'll pray and we close, and you can sign up with Sister Stewart for your session tomorrow.
Anyone that was at church today and you saw in your bulletin, we have a birthday corner. So we want to recognize, if you're not going to be here tomorrow, tomorrow is Brother Wilson's birthday. So make sure that you wish him a happy birthday today if you won't be able to make it tomorrow for his birthday.
All right. All right. And, I love to ask age, So if you are scared of telling your age, you may want to stay away from me a little bit. But I love to ask age, because when we look at Dr. Wilson and, the sharpness of his mind and, even his vigor and so on. So I want to ask you, I'm tempted. I'm going to yield to the temptation. What's the age, Dr. Wilson? 77. So that's just awesome. And, maybe I'm a little jealous too, because I'm inching up, but I'm not sure how far I'll get, but, I'm inching up. So, all right, so God is wonderful. 77 years, that's just a blessing. All right, I'm going to invite us to stand let me say thank you for coming out as we stand, and thanks to all those who shared in the services today. I was away in Warren at the other church, Alpha and Omega, but I'm so happy that I was able to join in this evening, and I will be with us for the rest of the month as we continue in our health presentations. Let us pray. Heavenly Father and our God, we praise you, we magnify you, because you are such a wonderful God to us. You have created us with a wonderful and marvelous body, and you have given us instructions on how to take care of this body. But you have also, because of sin and the effect of sin, even with the best care, sometimes we are fallen victim of different health issues. But you have given us enough knowledge and instruction on how to recover health. And we know it is through your power. So help us, Lord, even as we go from this session, that we will lean on your strength. We will lean on your wisdom, knowledge, and understanding. We thank you for Dr. Wilson and his team. We pray that you'll just continue to bless them and the work that they do. And as we all leave from here, even those who are watching online, we pray, oh God, that you'll help us to anchor our faith and our trust and our hope in you, even as we apply these health principles. And Lord, one thing we ask of you, that you would help us to make that decision, tough though it may, to make those necessary changes that will help us physically. We thank you for hearing us and for answering us. Take us home safely, we pray. In the name of Jesus, amen. God bless you as you go, and look forward to seeing you tomorrow evening. Look forward to seeing you on Monday evening and Wednesday evening. God bless you.